Under the Speaker's announced policy of January 4th, 2021, the Chair recognizes the gentleman from Wisconsin, Mr. Grothman, for 30 minutes.
Thank you. Thank you. Tonight, one of the first things I'd like to address is talk a little bit about one of the heroes of Wisconsin's 6th Congressional District, a woman by the name of Margaret Miller, who passed away late last year. You know, one of the things we do in this job is we sometimes try to advise young people on what they should do with their lives. And a lot of times those conversations revolve around occupations, and that's perhaps as it should be. I recently attended an event at a local high school where I talked about encouraging children to go into the STEM-related fields and go into an occupation there. Margaret Miller was a farmer's wife. When that farmer died, unfortunately, at a relatively young age, and she, of course, wound up having to run the farm and ran the farm for a little under 40 years. And of course, being a farmer is one of the most important occupations because they provide us with food, but not only that, one of the most difficult occupations because not only did she have to be a businesswoman, but she had to know how to handle all of the chores that you have to do on a dairy farm. And that dairy farm was in Manitowoc County, Wisconsin. She, as many people were, was a pillar of her church, St. Gregory's of St. Nazianz, Wisconsin. I knew her because she was a pillar of the Republican Party and a delegate to the 2008 convention in Minneapolis. But the reason I'm bringing up here tonight is I always feel when people plan out their life, they should have certain goals. And I wonder how many of the young people we have today will succeed in having such a huge impact that Margaret Miller had on Manitowoc and Sheboygan County. She wound up having 11 children. 6 of them were still minors at the time her husband passed away. Not only did she have 11 children, but she left behind 33 grandchildren, 47 great-grandchildren, and 9 great-great-grandchildren. If you add it up, that's right on the button, 100 living descendants. It occurred to me that while she didn't go to college, I know, her impact on that her life had on the people of Sheboygan and Manitowoc County was greater than virtually every young child has on their community today. I look at all the names of all the grandchildren and great-grandchildren and such in the obituary, and I know there's so many of them because just as I get around my district again and again, people come up to me and say, you know my mom or you know my grandma, and they're all great people. I asked them what they were doing. It seems like not only did she have 100 descendants, but 100 descendants of people you'd be proud to have as your children. So again, when I think of Margaret Miller, or when we think of Margaret Miller and people like Margaret Miller, I think very, very few young people today will have the impact on the society that she had of raising 100 descendants who get out and about the community, are good, hardworking, honest citizens of this country, and impart their values that Margaret carried in the church in St. Nazianz and that she instilled on her children. What a legacy. Margaret, you are so missed. Also, while we were gone on break, there was leaked a potential opinion in the Dobbs versus Jackson Women's Health court case. And I think us politicians are supposed to weigh in on it. I have been, in the last 25 years, as a public official, somebody who has been active in the pro-life cause. You know, I don't remember reading a lot about that cause growing up. And in 1973, I think a lot of Americans were caught off guard when abortion was ruled to be apparently a constitutional right by a then what I would consider very liberal court. At the time, I think the churches and the pro-life movements, which had not really gotten going yet, were surprised and caught off guard. Nevertheless, it is important that right now we decide how America is going to view abortion, because decisions are going to be made in district attorneys' offices, decisions are going to be made in attorney general's offices, decisions are going to be made by women and their partners as to what is right and what is wrong on abortion. Now, I feel that though this was a court decision and a properly decided court decision, I think it is somewhat horrific that it took over 49 years between Roe v. Wade and the decision that so many of us were waiting for. But that decision is only the first decision. Like I said, there are going to be decisions made in state legislators. There are going to be decisions made in district attorneys' offices, whether they decide to prosecute or not, or they're going to make public statements that they don't intend to enforce these laws anyway. And in Wisconsin, abortion will be made illegally right away. We're one of the few states that abortion is still legal on the books. There are going to be decisions made by the individuals themselves and their partners. What determines how people make up their mind? It has been my belief as a pro-life legislator for the last over 25 years that while there are pro-life organizations which are doing a good job of taking out ads and putting up billboards, and while there are pregnancy counseling centers which are doing a very good job, collectively the clergy in this country have kind of dropped the ball. This is a very important decision. For a lot of the last 49 years, I think it's now a little bit below it, but for a lot of those years, there'd be close to 1 million abortions a year in the United States. It would seem to me as a clergyman, one of the problems you would have is you're supposed to think of 52 different speeches to give every year. And it would be hard to cover 52 different topics. If you're a clergyman in an individual parish or church for 5 years, that means you've got to come up with over 250 interesting things to say. I think a lot of clergy would be looking for more things to say. Nevertheless, I would bet in an average year, most clergy, even in churches that are nominally pro-life, manage to go all year without discussing this topic. It is a topic that should be easier to discuss now than it was 50 years ago. For one thing, we have ultrasounds. And in 1973, when abortions were legal in the United States, we did not have ultrasounds. I'm sure everybody listening out there has seen the pictures of the ultrasounds. Nowadays, if a woman's going to have a baby, it's relatively normal. 3 months, 4 months to show everybody the ultrasound. It's so wonderful. You can no longer pretend, as you could in 1973, that that's just a piece of tissue. And I have toured abortion clinics as part of my research. When I was in the Wisconsin legislature, I authored a bill that required a 24-hour waiting period, and to my surprise, the local abortion clinics let me go through there. And I discovered going through the abortion clinics that the employees of the clinics made a point of always describing the preborn baby as not a fetus, they wouldn't use the word fetus, as tissue. And I always thought that the employees probably were educated to use the word tissue because it made it sound like it wasn't as an act that it was, that you weren't ending the life of a little baby. It made it sound like, something less than that. But we can no longer call it a tissue. Nobody would look at a baby 3 months after conception and call that tissue today. We all know because of an ultrasound that we have a little human being in there. And given that, it should be so easy for the clergy to alert or to instill the appropriate values in their flock as to people who have to make a decision about abortion. Nevertheless, I do believe that to this point, the American clergy have been pretty wimpy and pretty out to lunch. Not all of them, but way too many of them. And I think because of the lack of stepping up to the plate on this issue, polls do not show America as appalled with abortion as they should be. So the purpose of this speech is to ask any clergy who happen to be listening at home, or in case you are a parishioner of a church and your clergyman has never broached this topic, I would think sometime in the next 7 or 8 weeks, because most of you have already had to come up with different speeches probably in the hundreds in the course of your career, that you find a way to address this topic. I should point out there are individual churches who are bravely already addressing this topic. Churches like the UCC Church, the Episcopalian Church, have been out in front saying that abortion is not that big of a deal, or they think it's a big deal, it should be allowed. I think the nominally pro-life churches is where the problem rests. And I think if you go to a church out there, you should ask your clergymen, are you going to address this topic? Or are you going to still give the flock something without offending anybody, without scaring anybody, and therefore not address the issue? We will now have an opportunity to do something to reduce the hundreds of thousands of abortions in this state every year. But it comes down to what the American people think. The attorney generals that they vote for, are you going to call your district attorney if he refuses to do something? Like I said, I've been dissatisfied with the clergy, their response over the last 50 years. But we are going to find out now, because the ball is in their court, as to what they do to influence their flock's view of abortion. And if they do their job, there are going to be a lot less abortions in this country. And if they just go and hide, this new decision that everybody is all excited about is going to have no impact whatsoever. So, sadly, many of us have been waiting for this day for decades. But the result of Dobbs versus Jackson is, I think, largely going to be determined by what the churches make of it. The next topic that I would like to bring up, and that I've talked about before in this microphone before, but I still feel has to be mentioned again, because the public health professionals of this country continue to drop the ball, is the effect vitamin D can have on. There was one recently by a Dr. Dror in Israel, and he people in the study. But according to his study, people who had adequate levels of vitamin D, or if you had inadequate levels of vitamin D in your system, you were 11 times more likely to die of COVID and 14 times more likely to be hospitalized. Now think about that. I have personally known 9 people who have died of the COVID. I have no idea how much vitamin D they had in their system. Nevertheless, it's relatively easy to increase the vitamin D in your system. It is relatively inexpensive to increase the vitamin D in your system. Dr. Dror used a threshold of 20 nanograms per milliliter, which is not very much. Should be very easy for the average American citizen to take a couple vitamin D pills a day and greatly decrease your chances of getting vitamin D. Like I said, for whatever motivation, the public health establishment does not educate people on that. I have lectured hospital administrators on this. It would seem to me that if a person who is, say, 60 and up, or anybody who has any other pre-existing conditions, ought to routinely get a vitamin D test when they go to see a doctor. And if they would get that test and it came back at 16 or 17, they should be very alarmed, and the doctor should tell them to take vitamin D, and I'm sure they would. I have heard a person involved in administration of hospitals saying, well, you can't get patients to do anything anyway. That's preposterous. Of course we can get patients to take vitamin D. People are scared enough that today they are all, I see right now, people wearing masks, despite the fact that there's some evidence that they might not be effective, and despite the fact that they don't make you feel that good. If you take a patient and show them that their vitamin D levels are below 20 nanograms per milliliter, I would think and tell them that they are 11 times more likely to die of COVID than someone with adequate vitamin D, I would think in almost all cases, people would go out and get that vitamin D and get some zinc with it and greatly reduce their chances of dying of COVID. Some people will say that vitamin D may not be the cause of, not be the thing that keeps people healthy. There may just be a correlation there. But the same thing is true of things like diabetes or COPD. We would never say, oh, we're not going to talk about diabetes and the increased chance of COVID because you can't prove it caused the death of COVID. All you've shown is a correlation. This is not the first study that came down the pike this way. There are studies done by the university, or mentioned by a professor at the University of Chicago. I talk routinely with a professor at California, Berkeley. I mean, top flight people know that vitamin D saves lives. And when you look at over the 1 million Americans who have died of the COVID, you got to wonder how many would still be alive today if the public health establishment and the doctors of this country were on board in trying to save these lives. One of the complaints of doctors is that they feel that they will not be reimbursed by the insurance companies or Medicare adequately to cover the cost of the vitamin D test. I mean, I know if you get a vitamin D test at home, it costs like $40. I don't know what it costs a doctor, but let's face it, tons of money flow through the medical institutions today. If the only reason that we are not educating people about vitamin D is these hospitals feel they need more money, that's pretty pathetic. So I encourage anyone out there to Google vitamin D, learn a little bit more about it, and if you are going into a doctor, even if you've got to pay for it yourself, make sure you get a vitamin D test and make sure you have an adequate amount of vitamin D in your system. My final topic tonight is one more time the border. We was down on the border again about 3 weeks ago. Things that Americans should know: the number of people streaming across the border is very high. In March, it was 153,000 people let in here. A lot of times, I think when politicians or commentators talk about what's going on at the border, they misstate the statistics because they get the number of people who come here and the number of people who show up at the border and turned away confused. But in March, we were at 153,000. A year ago, we were at 63,000, and 2 years ago, we were at 11,000. So we're at a difference between 11,000 people coming in the country and 153,000 people coming in the country. President Biden's appointees have said they inherited a mess. They did not inherit a mess. They inherited, in a March, 11,000 people coming here, and right now we're at 153,000. It is not rocket science as to what has to be done. We have to go back to the Migrant Protection Protocol, in which people are held in Mexico pending a hearing, and if they have to sit in Mexico, they will not show up here in the first place. Right now, we have a system in which we know that people who show up who are not from Central America or Mexico will be given a court date and allowed in the country. With complete confidence that that is going to happen, they will come here. And the drug cartels which may be making more money bringing people here than drugs, will make sure that everybody around the world knows that now you can come in the United States. I mentioned first the Migrant Protection Protocol because if you talk to the Border Patrol, even more than more money, and they certainly need more money, they just need a change in attitude of the Biden administration. I really feel that we are losing the country south of the border. We cannot continue to take over 150,000 new people a month who are not appropriately vetted. Of those 153,000, about 60,000 are what they call gotaways, which means they haven't even met with the Border Patrol. They could be criminals who are coming here. They could have criminal background. They could be bringing in drugs. Nobody seems to care. And in something that is totally appalling, the Biden administration doesn't seem to care. I'll also point out that over 90% of the fentanyl in this country comes across the southern border. We're right now at a point where 110,000 people are dying every year of fentanyl poisoning in this, of illegal drug overdoses in this country, the vast majority of which is fentanyl. I think the idea that the people of this body or the people in the White House do not seem to care a great deal is horrific. Some people think it's a victimless crime to possess fentanyl or to sell fentanyl, or they think it's not a violent crime. We have too many people in prison. It's not that important to check people coming across the border. By the way, we should be getting more dogs at any time down there in the upcoming budget. The drug-sniffing dogs, they just do a tremendous job at the border. But in any event, again, the American people have to speak up. The idea that we spent $40 billion or passed a bill for $40 billion yesterday and couldn't come up with a couple $100 million for a border is a callousness towards the families of those people who are dying of drug overdoses I cannot fathom. But I'm not in the majority. I don't determine what we vote on around here. But in any event, I hope and pray that in the future, the people of this body and the people of the White House view the 110,000 people who die every year of drug overdoses as a tragedy, that they put themselves in the position of the parents or the siblings or the children of the people who die of the drug overdoses. And I'll point out 110,000 is twice the number of people who died in a 12-year period in Vietnam. Think about that. I'm old enough to remember Vietnam. It was a big deal. People protested. So many people are dying. Every year, twice as many people die of illegal drug overdoses in this country as died in 12 years in Vietnam. So I hope people in this chamber decide to do a little more to deal with the problem. I hope our president decides to do a little bit more to deal with the problem. Thank you.
Does the gentleman yield back?
I yield back.
Pursuant to Section 11